Today I will be teaching common terms that are used in pregnancy. There are certain terms that once we are dealing with pregnancy, we use them. Such terms like the lie, the presentation, the engagement, the position, the attitude. Five of these main terms that are used when we are dealing with a pregnant woman and with issues relating to pregnancy. A lot of health personnel, be them doctors, midwives, nurses, what have you, need to refresh their minds with this video. It's like a refresher course for this topic and for those aspiring to study. And it is also very important for us, men and women that are dealing with reproductive health. Subscribe to our channel. You like and share. We will keep discussing very important issues relating to reproductive health. My name is Dr. David Ayim. I am your reproductive health expert, and I hold a PhD in public health. Now, this is what I am talking about. Five terms commonly used in obstetrics. This science that deals with pregnancy and childbearing is called obstetrics. Once we are dealing with pregnancy, it is important that we understand the use of these terms: the lie, presentation, engagement, position, and attitude. Now, we are starting with the lie. You can find this sketch, as I've made here, representing the uterus, the womb of the pregnant woman. If this is the womb, then a baby is inside that womb. This is the head of the baby, and that is the buttocks. This is the vagina. This is the cervix with the internal os and the external os. Now, what do we mean by the lie here? We define the lie as the relationship of the long axis of the fetus to the long axis of the uterus. The uterus is, up along the long axis is like so. And the baby lying inside there, the long axis of the baby, even though baby is curved, but the long axis is still to the same direction. This is the long axis of the fetus, and it is lying parallel to the long axis of the uterus, meaning it is lying to the same direction of the long axis of the uterus. This type of lie is known as longitudinal lie. It's a longitudinal lie because the baby is lying in the way that the long axis of the fetus is to the same direction to the long axis of the womb of the woman, not the long axis of the spine. We are talking about the long axis of the uterus, of the womb. Now, on the other hand, this is another sketch. This is the womb of a woman, and the baby inside the womb is lying across. What kind of lie is this? We said the lie is the relationship between the long axis of the fetus to the long axis of the uterus. Now, the long axis of the fetus cuts across the long axis of the long axis of the fetus, this baby, its own long axis cuts across the long axis of the uterus. This kind of lie is called transverse lie. Now, there's another type of lie, this one. A sketch of the womb, and the baby is lying diagonally to the long axis of the womb. You see, the long axis of the fetus is cutting diagonally or obliquely across the long axis of the womb. This kind of lie is known as oblique lie. Now, let us go to the next topic, presentation. Now, presentation simply refers to the part of the baby that lies lowermost. This is the uterus we have sketched here. The part of the baby lying lowermost in the uterus. So if this is the womb of a woman and the baby is lying inside, this is the head, that is the buttocks. The head, if you enter through the vagina to enter into the womb, the part of the baby which is lowermost is the head. Inside the uterus, the head is in this case, the head is the lowermost part of the baby. And that is what defines the presentation, what we call cephalic presentation. So the presentation here is cephalic or vertex. But we will say vertex if the occiput is leading or is the leading part. A lot of people use this word vertex, but they don't understand that vertex is well defined. A situation where the fetus inside the womb is well flexed and it is the occiput, what some people commonly call the ngopo. Okay, the occiput is the leading part. If you have to send your 2 fingers through the vagina to touch the baby, which is the part that you touch first, we know that the head is presenting. But which part of the head is leading? Is it the occiput, the brow, or the forehead? Is it the chin? Is it just the direct face? In the case of vertex, the leading part of the presenting part should be the occiput. That one now is vertex. If not, just refer to it generally as cephalic presentation, meaning the head is lowermost. In the next sketch, this is the womb as well sketched. And the baby inside is lying such that it is the buttocks that is lying lowermost. The head is inside up there. Down, lowermost in the uterus is the buttocks. That type of presentation is called breech presentation, or podalic presentation. Okay, where the buttocks is presenting, but it is more podalic presentation if the sacrum is the leading part, because we know in a breech presentation, in most cases, the sacrum is the leading part or the denominator. Thank you. Now, engagement. What then do we refer to as engagement? Engagement. This is a situation where the largest diameter of the presenting part has entered into the pelvic cavity, such that when you palpate the abdomen of the woman, the lower part of the uterus is firm and fixed, so it doesn't ballot. But in a case like this one, we saw the presentation here, the head of the baby is still free, has not yet entered into the pelvic cavity. If you palpate the abdomen, you will feel the head that is hard, round, and movable. You can tap it and it ballots. But in the case of engagement, the presenting part is not ballotting. It is fixed to tell you that the largest diameter of the presenting part has descended into the pelvic cavity through the brim. Okay, that is engagement. Number 4, position. What then do we refer to as position when it comes to obstetrics? I want to take this small sketch. Let's look at the pelvic cavity. It is round. This is the front, and that is the back, and these are the sides. Now, this dimension from front to back is what we refer. So here is anterior, and there is posterior. That's behind, and this is anterior. That is in front. But then we have the left side, the left here, left lateral, and then this other way we have the right side. Okay, if we have divided the pelvis, right down there. Just picture the pelvic cavity down there. We say there are 6 areas. What do we define? How do we define position? We say it is the relationship of the denominator or the leading part of the presenting part to the 6 areas of the pelvic cavity. Now, what we have to understand as the denominator or the leading part is, like I said here in the case of presentation, I said if the head is lying lowermost, it's presentation. But the part of the head that is leading, this occiput, for example, the occiput is the leading part. So we shall use the leading part, like this case, occiput, to describe the position down here. In that case, we must first of all divide our pelvic cavity into the 6 areas, considering that this main line separates left side from right side. But then you can still bring in diagonally and still go that way. You will see that this area I am shading here, we can name it. It is on the left side, but anterior. This is directly what we call left anterior, LA. So you see, this other area now, all directly, it is neither anterior, this one is neither in front nor posterior. So we call this one left lateral, LL. And then that part behind there is still on the left, but it is left posterior, LP. So you can see only on one side, on the left side, you have left anterior, you have left lateral, and you have left posterior. On the other side, this right side, we still have the right anterior, RA. Then this one double all like that is right lateral, because it's directly right, neither anterior nor posterior. This whole side is right lateral. But directly behind there, that part is still on the right side, but it is right posterior. Therefore, the left side of the pelvic cavity has 3 areas, and the right side also has 3 areas. This is what we describe as the 6 areas of the pelvic cavity. Where is the occiput of the baby? If the head of the baby descends here like so, this is a baby that has, the head has descended into the pelvic cavity. Where is the occiput? See, this is it. This is it. This is the occiput, the back head. And where it located as to the 6 areas, you'll see that it falls here. Where is this place? Left anterior. Therefore, use the word occiput to state the position. I will say left occipital anterior. That is LOA. Left occipital anterior. What if this baby was lying the opposite way? Let me just sketch here and then put the line this way. Then put the head of the baby this way. Once it is this way, it means that this occiput is where? Here. And it is on the right side. And the right side, right anterior, not right lateral, not right posterior. So, in this case, you say the position is what? Right occipital anterior, ROA. A lot of people know about LOA and ROA, which is here. If this position is the occiput and it's left anterior occipital, means that if it was here, it is right occipital anterior. But if it tilts laterally, which is a very rare situation, that one will be called left lateral. But in also very rare conditions, you may find the occiput of the baby right at the back. If it is to the left, then it is left occipital posterior. If it's to the right, then it is right occipital posterior. This is very important, but that is very rare. Any baby, any fetus in the womb that descends into the pelvic cavity in a posterior position, that labor will prolong because there is going to be rotation. It's going to rotate all around to come anterior before it is delivered. We need to take great care and note about this. Another way to quickly determine the position is palpate the abdomen and determine the back. The back, when you are palpating the abdomen, the back of the baby is that side that is smooth and hard. It means that the back of the baby is there. And then you palpate, you do pelvic palpation, that's down around the pelvis. If the head is down there in the pelvis and the back is on the left, that tells you automatically that the position is left occipital anterior. If the back of the baby was on the right side, the back of the baby was instead on the right side and the head is down in the pelvis, it is automatic. The position is right occipital anterior. So sometimes a well-trained doctor, a medical doctor, a well-trained midwife, well-trained nurse, just by palpating on the abdomen can determine the position. Yes, then the last number 5 term that I want us to understand here is attitude. When they talk of attitude, what do we mean? We are referring to the relationship between the hands, the legs, the head to the trunk. So sometimes you need to understand that a baby may have the head tilted towards the chest, yet the legs tilted towards the chest, the hands tilted towards the chest, and baby is lying inside the womb as if it is round. Okay, that attitude is referred to as complete flexion, an attitude of complete flexion. So when a baby is growing normally in the womb of a woman, it is totally and completely flexed. When it is completely flexed, then the head is presenting, you see that it is the occiput that is the leading part. If it is the buttocks that is presenting, you see that it is the sacrum that is the presenting part. So this relationship where the hands go to the chest, the legs come to the chest, even the head tilted towards the chest, and the baby lies as if it's round, that's an attitude. It's referred to as attitude. And the attitude, normal attitude, is that of complete flexion. I think this was an interesting exercise, but let me come back and just add one word: under position. What if it was the buttocks of the baby that was presenting, that was lowermost inside this cavity? You see that the sacrum is the leading part, and then it is the sacrum if it's lying this way, if the back of the baby is on the left, and then it is the buttock that is down. Automatically the sacrum is what you use to present, to put the position left sacral anterior, because you're describing where the sacrum, the leading part of the presenting part is, and the leading part there is sacrum. Say left sacral anterior. If the back of the baby was on the right side and the buttocks is down, then position is right sacral anterior. Thank you. Subscribe to this channel and we will continue to learn more. As I said, my name is Dr. David. Thank you.